Unit 18, a presentation on health promotion. Section 1. Health promotion can be defined as providing individuals with education and information which can enable them to make informed choices about their lifestyle, to improve and monitor their health and well-being, which can benefit themselves as well as the nation. Health promotion focuses on primary areas, example, individual well-being and mental health, diet, obesity, and physical exercise, smoking and drugs, HIV, and sexual health. Although in England, Wales, Scotland, and Northern Ireland, there may be slight variations in health promotion, but primary areas remain the same. The two health promotion campaigns will be Change for Life and Human Papillomavirus Virus campaign. Change for Life. This health campaign was designed to tackle obesity as childhood obesity was increasing, and to encourage families to make healthier choices. This is a public health England-led health initiative launched in 2009. The idea behind this was childhood obesity prevention and to target parents with children aged 5 to 11, especially families whose parental attitudes, beliefs, and behaviors indicated that their children were at high risk of weight gain. The campaign was split into 4 stages: alert, motivate, support, and sustain. Alert. The negative was to address the negative effects of excessive sugar consumption and to create the awareness through education and through personalizing messages to families. Motivate. Parents are encouraged to be in charge of what their children consume and at what times. Support. Free assistance is provided to families in larger Change for Life groups, and families are encouraged to download the new Sugar Smart app. Sustain. Advice is offered to parents to reduce the amount of high sugar goods, sugary breakfast, cereals, and sugary drinks given to their children. Change for Life had about 4,000 families signing up in the first year. Showing how successful and accepted it was by families. 1 million mothers were able to testify to the direct impact the program has had on their children's behavior. The campaign was to reach 99% of families, and in the first 12 months saw about 4 million families joining the program. The impact of the health promotion campaign on individuals and society was able to reduce the levels of illness and disease. Through health promotion, individuals are educated on the effects of smoking, high cholesterol levels, and high blood pressure, which leads to the reduction of heart disease and puts pressure on the NHS. Impacts on crime levels. Through health promotion, crime levels are reduced. Programs like Talk to Frank have had positive impact on individuals. taking recreational drugs, and excessive use of alcohol. All these, which led to individuals getting involved in violent crime, are reduced. Certain diseases are eradicated through the promotion of certain vaccinations and screening programs nationally. The NHS and government spent 4.2 billion treating obesity and conditions associated with obesity. Smoking, drinking, substance abuse health promotion has played part in reducing the amount spent in these areas. Section B. Human papillomavirus vaccination program was targeted to help reduce cancer and cervical cancer in women and other forms of cancer in men. In 2008, the human papillomavirus vaccine was introduced, targeting girls aged 12 to 13 to aid in the reduction of cervical cancer. It recorded great success in Scotland, finding a drastic reduction in cervical pre-cancer among vaccinated women. Recently, the vaccine is being offered to boys as there are more same-sex relationships on the rise. It is estimated by public health that the program will help prevent 64,000 human papillomavirus-related cervical cancers. Question 2. Outline the proposed health promotion activity. The objective of health promotion is to ensure the general public health improvement by encouraging and maintaining a healthy lifestyle, as most illnesses are connected to lifestyle choices. Health education is a way of spreading health information to encourage people to change their lifestyle and to improve their health. Health promotion is centered on working with individuals in partnership towards making agreed changes and not imposing one's ideas on them. The three strategies for health promotion are advocate, enable, and mediate. Advocate is boosting factors which encourage health. Example: social, economic, politics, environmental, behavioral, and biological. All these can help in boosting or hindering an individual's life. Enable, allowing people to achieve health equity. This is to ensure gender equity in health, that both male and female have equal access to opportunities and resources to attain full health potential. Mediate, allowing collaboration among all sectors, that is across non-government and volunteer organizations. Government, health, and other social economic sectors and media need to promote health. Section 2B. Name of the health promotion campaign is colorectal cancer, also known as colon cancer. The purpose of the health promotion campaign is to create awareness of colon cancer and to encourage individuals to go for screening. The resource chosen for the health promotion campaign will be a story post that can be put up on social media platforms through advertisements, watched as short videos, and posters can be put up in the GP surgeries. There are around 42,900 bowel cancers in the UK every year, which is nearly 120 every day diagnosed with colon cancer. Holding educational sessions in small groups will not spread the education far enough. Therefore, mass approach will be used. The mass approach will be used as a means of reaching a large number of people quickly and easily, which is an advantage. Most people spend time watching television, documentary films, listening to radio, reading the newspaper, or on social media platforms can be used. The only disadvantage is the mass approach is a one-way communication, and information passed on may be misunderstood by people and will not be able to get clarification in time, as they might not know where to go for help. The health promotion creates and encourages people to go in for the screening test kit alongside keeping a healthy lifestyle. The health promotion will be released beginning of the year, a year when most people make New Year resolutions, and they will be able to factor the screening into their plan for the year. Health promotion campaign is planned to last longer than usual, as this is a major concern and a rising health risk among male and females. It will run throughout the year, creating awareness of the recent review of colon cancer screening offered to people aged 50 to 74 using the fecal immunochemical home test kit, that's FIT. Unlike before, when individuals aged 60 to 70 were invited for a test. Question 3. The rationale for the proposed activity. This theory can be used as a framework to provide a different outlook to understand the range of factors that influence the health and well-being of an individual. The ecological model will be used for the health promotion and disease prevention program. This model believes that behavior is influenced at various levels, which can be at interpersonal or individual levels or individual factors. These influence behavior such as knowledge, attitudes, beliefs, and personality. Interpersonal factors. This looks at how individuals interact with other people, which can provide support socially or inhibit one's interpersonal development. That promotes healthy behavior. Institutional or organizational factors. This involves rules, regulations, policies, and informal structures inhibiting healthy behaviors. Community factors. This can hinder or promote healthy behaviors, which can be formal or informal. Social norms, which exist among individual groups or organizations. Public policies. This includes local, state, and federal policies and laws that regulate healthy action practices for disease prevention. Question 4. To determine the effectiveness of a resource developed for a chosen health promotion activity, an evaluation needs to be done to ascertain the success or failure of the activity and to know which areas to improvement can be done. An evaluation plan needs to be written up and chosen before the health promotion is released and then referred back to after the launch and completion of the health promotion. An evaluation plan should be guided by these steps. Describe the program, the policy and the context and the target group. Supporting evidence and critical assumptions should be described, as well as objectives and goals. And previewing. Previewing should be done with the stakeholders as well. An advantage of an evaluation is it serves as a point of reference for a health educator to determine what could be done or put in place to make it more effective and find ways to improve on that. The only downside will be rigorous techniques need to be employed to determine the effectiveness of the evaluation. There are 6 steps to evaluation, 6 techniques. 1 is to focus the evaluation design. The two main programs used are process evaluation and outcome evaluation. Both strategies can be used in gaining critical insight on the effectiveness. Process evaluation. This process regulates all aspects of the program delivering process and is useful for tracking the program. It's useful for tracking the level of implementation of all aspects of the program. Third, impact or outcome of the evaluation. This is used to evaluate the short and long-term impact of the program. Determine how best to analyze data and interpret results. This involves summarizing all the discoveries, themes, and information contained in the raw data during data analysis. Disseminate lessons learned. Training, publishing findings in a report, personal face-to-face contacts, including briefing or presentations. These are ways to disseminate the results of a campaign. Sharing the findings of the evaluation is needed for building a solid evidence base for health promotion. The success and failure of the health promotion must be documented by the health educator and determine who gets access to the findings. Thank you very much.